We're going to talk about porcelain veneer temporary restoration fabrication. These are the final porcelain veneer provisionals. Before you fabricate the provisional veneer restorations, you should wax up a study model like this. This is polyvinyl siloxane putty. Place this on the dampened model and mold it to place so you get a good impression of the waxed up teeth. Mark the midline. Wet the waxed up model again, and this is polyvinyl siloxane wash material. Squirt the wash material into the putty matrix and put it to place. So then you cut back the wash material. This is bisacrylate Luxatemp that I'm squirting into the model, and then I want to be sure to keep the tip of the gun on the bottom of the matrix. That way you avoid air bubbles. Then I'm going to wet the teeth. You want the teeth to be soppy wet. The matrix in which I have injected the bisacrylate is then pushed onto the prep teeth. So let it set, and then you just kind of rock it off. You can see how clean those margins are. I'm going to wipe the teeth with Tublicid Red, and then I'm going to tease this out, and you can spring the matrix this way and it'll loosen it up and you'll be able to take it out in one piece. I find this disc very effective for cutting off the excess. Now it's got grit on both sides, diamond on both sides. You don't want to do much adjusting with an acrylic burr. It's prone to grab in the provisional fractures. So you can use it at real high speed in a slow speed handpiece with light touch in the body of the provisional. Now in this case, because the technician didn't wax a thickness at the gingival line, I want to show you this so you know what to do if it happens. I'm going to have to add some flowable composite at the gingival line. Just blend it in right at the gingival line. This creates marvelous margins. And I'm using that tip to just kind of round it or flow it onto the body of the provisional. Now this is the spatula. Then cure, doing the same thing on the anterior teeth in these areas that are kind of thin. So with a very light touch and lots of water, I'm going to come back and polish those margins with the provisionals on the teeth. They're not cemented, they're on the teeth. So I'm not touching the tooth, I'm just creating perfectly blended margins. Just a little bit with this diamond disc. Now, where you're going to connect the provisionals, where you've broken them, be sure you cut this back so there's not a perfect fit right there. You want a little bit of space so you can easily seat the provisionals. So high speed. Lots of speed and light touch. Then I'm going to polish them with composite polishing paste on a slow speed handpiece with a Profi cup. I like to drip water on the paste while I'm polishing. Then this is a Shofu rubber wheel. I'm going to clean the teeth again with Tublicid Red and just a dot of etch on each tooth if you want the provisionals to be a little stronger. Then we're going to come back with the Scotch Bond unfilled resin, adhesive only, no primer. Push into place. And then I'm going to blow off the excess into that 2x2, continuing to hold them in place, and I'm going to cure from the palatal. Fast, easy, accurate. Provisional bisacrylate restorations for maxillary anterior veneers. And that's the Dental Minute.
We are so happy that you joined us this week on the Dental Minute. Make sure you press subscribe right here, right now, and join us next week when we show you endo of hypersensitive teeth. You will not want to miss it. See you next week.